Good afternoon, everybody. A really warm welcome to our Share and Learn in Nottingham City ICP this afternoon. I'm Tracy Tyrrell, Deputy Clinical Lead for Nottingham City ICP, and I'm delighted this afternoon to be welcoming Lynn Bacon, Chief Executive of Nottingham City Care, where I'm also the Director of Nursing in AHP. We've also got with us for questions Dr. Hugh Porter, who is our lead for the Nottingham City ICP, and Rich Brady, our Programme Director. So what we're going to do this afternoon is hear a presentation from Lynn. We're going to invite you to make questions in the question box, and then after Lynn's presented, we'll start to take some of those questions. So I'm delighted now to hand over to Lynn. So welcome, Lynn.
Thank you, Tracy. Welcome, everybody. I really wish that I could see you all. It's really strange seeing a screen, but I'm going to just start by going over some of the kind of core things about City Care. So we're an organisation that delivers community health services predominantly in Nottingham City, but not exclusively. We're a social enterprise, so we're part of the NHS family, but we're not actually an NHS provider, and we are commissioned, so we get our money from the NHS, so the CCG and the local authority, and we do get some resources from other funding streams, for example for education through Health Education England, from the big lottery for our Small Steps Big Changes programme, and also research funding. So we do have multiple sources of income coming into the organisation, and we're a key partner in the wider ICS system. So we are part of the ICS board, part of the ICP, and so we help to frame and shape the development of our system. And you can see there about the scale. We have just over 1,200 staff. And if I could just move on to the next slide, please. So what is a social enterprise? Why is City Care a social enterprise? And we are a social enterprise because of NHS policy. So going back to 2009-10, transforming community services, where organisations were given a choice when we separated out provision and commissioning of services. So social enterprise have been around for a very long time. They're not anything new. So if I go back to pre the NHS in a place called Tredegar in Wales, where Narin Bevan came from, that in that community, local workers were paying their employer, I don't know how much it was, but a very small amount regularly for them to employ a doctor. And what the workers found was that they weren't getting a great benefit from it. The one doctor for all of the workforce wasn't enough. So they took control of that. They started to collect the resource themselves. And what they did was they were able to get a lot more. And if there were any surplus, so if there's any money left over at the end of the year, they would reinvest that back into local healthcare, and they stood out as being different and being able to have a very different offer through the way that they worked collectively and invested the resource that they collected together. And so in effect, they didn't call themselves a social enterprise, but that's exactly what a social enterprise does. And if I think about other social enterprise that you might not consider, so Big Issue is a social enterprise, and really their mission is to break down poverty, to help people to get themselves out of poverty. For those of you who've been to the Eden project, that again, that's another social enterprise, but really focused on the environment and sustainability and linking people with plants, resources. And also Jamie Oliver, 15. Again, another social enterprise really focused on young people who are vulnerable, giving them employment, giving them skills. And at the roots, all different things, but actually fundamentally organisations who exist to have a social mission and to improve lives or to improve the environment. And that's what City Care does. We deliver NHS services to do exactly that. And we're one of 3 social enterprises in Nottingham. One is DHU, which is what delivers 111 service, and the other one is NEMS. So exactly as I've said, we're not shareholders, we don't have profits for others, we're not a private company. Anything that we gain is invested back into our local community, and that enables us to have freedoms to be flexible. So when I say that, we do employ staff on NHS terms and conditions and pension, and our regulation is the same as the NHS. So, for example, we're the first social enterprise in the country to become have an outstanding CQC. So again, we're aligned to the NHS, but we actually work for local people. So can I have the next slide, please? So how do we work in partnership? So we work every single day working together with partners in the NHS, and we have services, and we've got staff working at the front door of NUH, helping to put people back out into the community without them being admitted into hospital. We've also got staff working in the IDT or the integrated discharge team within the hospital, working with social care, working with our partners in NUH to then support smooth transition and discharge home or into bedded facility within the community, and working with the local authority very closely, working with them in terms of home care, supporting discharge, working with primary care very much on a day-to-day basis, services working linked into GP practices. From the private sector, we work with care homes that are predominantly private sector, so we support them, we wrap services around them to help care for patients, and also we work in Mid-Knots on a lung cancer testing service with a private provider who has the imaging services. So on the photograph that you can see in front of you, you've got on the left, we've got Graham Moran, who's the Chief Executive of Nottingham Forest in the community. In the middle, we've got Karen Frankland, who is our business director, and Karen's also the chair of Notts Forest in the community. And the other side, we've got Joe, who is a local entrepreneur who set up a company called UK Meds. He's from Clifton, and he actually makes PPE. So at the beginning of COVID, Joe went nationally to offer PPE, and he was told that he wasn't going to get any money for what he was producing. And he said, well, if I'm not going to be paid for it, then I will go locally. And that's what he did. So he contacted us, and what you can see are the three people on the photograph with PPE that we delivered to care homes, that we delivered to other organisations, to our bases, to protect staff from across the sector, and we offered mutual aid. In addition, working with the charitable sector together and Tesco's, we worked in getting food packages together for people being discharged from hospital, so that we could, again, together with Forest, we could distribute that to people in their own homes. So our connection with the community is a fundamental part of us being a social enterprise. Can I have the next slide, please? So what do? As I've already said, we deliver lots of services, and I think the range of services that we deliver is huge, from people who are pregnant all the way through to a fantastic end-of-life care service, a really big important part of the work that we do. We also run the Urgent Treatment Centre on London Road, and through that centre, not only do people walk in if they need urgent care, but also that we take people directly from EMAS, so from ambulances diverting people to us rather than going into ED. And we also have people from ED who come directly to us with minor injuries who can be seen out of hospital. And also direct bookings from 111 service, again, trying to reduce the pressure on our partners in the hospital. So we work anywhere, really. We work in schools, healthcare centres. Historically, we've worked with taxi drivers, in hairdressers. So in effect, it's about where care is needed. And I think that's one of the challenges of working in community, around the number of bases that we work in. We're very research active, so we're quite smaller than a lot of the organisations in the system, but we really punch above our weight in terms of the volume of research that we do. and we also really support the development of our staff in becoming better and I suppose developing their careers as researchers. Can I have the next slide, please? So I'm not going to go through all of this, but I think it's just to give, this is not all of the services. I can see that interpreters aren't here, but just a range of the number of services that we actually do deliver. So can I have the next slide, please? So I want to talk a little bit about small steps, big changes. I'm not going to go into detail because there will be a future Share and Learn session specifically on this. But City Care are the accountable body. We're the lead organisation that bid in 2013 for £45 million worth of grant funding to support the development of very young children in our most deprived communities. And as you can see, it's a partnership between a range of different organisations. But the key thing here is, in this photograph of both mum and baby, is that local people, local mums, local dads have been absolutely fundamental in the delivery, development of those services and are involved. Last week I was at the Small Steps Big Changes board meeting. There are lots of children involved. Parents take a lead in chairing the meetings at times. So it's really inclusive, and it's about really learning what do we need to do differently about the future of our children in terms of nutrition, social and emotional well-being, and that kind of early language and literacy skills. So can I have the next slide, please? So just introduction to who we are. I'm conscious that Michael is the only man on our board, and he does have to put up with a lot. I'm sure he would tell you that. So Michael, the chair, Michael has a social care background. He was director of adult social care in the City Council for a long time before moving to Cornwall and chaired a social enterprise. Myself as chief exec, I'm a nurse midwife by background. Karen Franklin, Director of Business and Marketing. Karen started career working in John Lewis and started working in the NHS on the reception, and has been an absolute role model for our corporate staff around the development and opportunities for staff irrespective of their background. And Tracy, who's been an incredible role model for our nursing AHPs and also our Director of Clinical Services. So can I have the next slide, please? And we've got Lou Bainbridge is our Director of Finances and Corporate Services. Lou's got extensive experience of working in commissioning and working in NHS organisations as well as City Care. And then we've got Kathy, a non-executive director who chairs our audit committee and has experience of business. Anne, who's got experience in finance, and finally Lynn Woods, who's a retired nurse who, as we speak, is probably vaccinating people in our COVID centres and has really got responsibility for quality. So if we can move on, next slide, please. So our vision, building healthier communities. It's really easy to skip over this, but from our point of view, our mission is to build healthier communities. It's not about going in and delivering the best services we can. Building means that we work with others to do that. It's something that you build together. And actually healthier communities is really about how we work with local communities rather than we're an organisation that just delivers services. It is about how our whole philosophy of working together with others to support other organisations in delivering services for the benefit of others. Our values, integrity, expertise and unity, probably you may well see those in most organisations who deliver and care for people, but I do think it's that we live our values as an organisation. I feel that we strive very hard to do that. We try to do the right thing, even if that gets us into trouble, we will always try and do the right thing. And the expertise of our staff, sometimes we think that expertise is in specialist areas, but I have to say, as a community service as a leader of a community service organisation, we do deliver very specialist services, and the expertise of our staff is fantastic and very often overlooked, that we can do a lot more than maybe the system thinks that we can. Unity, I think I'm hoping that I've shared that we do an awful lot in terms of what we do together. And enterprise is about really how as I've said right at the beginning, that in order to do more social value, we have to then, actively look at how do we get resources to do that. Some of the social value that City Care's delivered historically is we've invested in a local football team for children with learning disability and supported our staff to get the skills in taking that over. We do social nail clipping, that is something that is not commissioned or funded in any other way. We've supported facilities in charitable organisations to help them to support others. And more recently, we've invested in Nordic walking for people with Parkinson's disease, and also walking sessions for people to support them with their mental health. Can I have the next slide, please? So our strategic priorities, again, I don't think there'll be any surprises in here. I think I probably covered those. It is about delivering the very best care that we can, being a good place. We've spent an awful lot of time during COVID really ramping up the well-being and support for our staff. There's always more to do, but it's really making sure that we do the very best we can to be a really good employer. Can I have the next slide, please? So our children's services, that we have a public health 0 to 19 nursing service and child health information service. And I say that this is because we've been working so closely with the City Council to integrate our children's service offer. Historically, I would have said we've got our school nurses, our health visitors, but actually we've worked very hard and as good partners in actually redesigning those services together as both commissioner and provider. And of course, as always, really at the forefront of what we do is around the safeguarding of both children and our adult services as well. Can I have the next slide, please? And our adult services, I think we're working really hard at the moment. We've always redesigned our services around, place, and around, at the moment, we're working really hard on the PCNs, as PCNs are developing to be a real partner in the PCNs, development of those multidisciplinary teams between health and the local authority, working very closely with our partners in primary care. And so it's a really key, important part of the work that we do. And again, we're on a journey, but we have redesigned our services completely to make this happen. Urgent care services, home first, again, I think I've already mentioned that, working with acute, working with partners to make that happen and try and get people who don't need to be in hospital home as quickly as possible. And we have an integrated care home service in which, again, we wrap around support to care homes, staff visiting, doing training, and a whole range of activities directly focused on the care homes. Next slide, please. I've talked about the urgent treatment centre and just some of our specialist services that I've already mentioned: integrated respiratory, primary care cardiac service, stroke, neurological services. There are others, Huntington services, a whole range of services that we deliver. Next slide, please. So over the last 12 months, like all organisations, it has been incredibly difficult. Tired staff who've had to move from one service to another to ensure that we deliver safe service as possible. We've lost staff have lost family, we've had bereavement. It's been a really difficult year, but actually what we've done has been an incredible response to the pandemic, whether that be supporting with the COVID vaccinations, working to vaccinate people who are housebound, working with system partners to make sure that we get as many people out of hospital as we possibly can. And I think that what we've worked really hard to do is to continue to integrate very much with all of our partners, primary care, local authority, and again with our community voluntary sector partners. So I think I'll close there and open up for any questions.
Thanks, Lynn, that's great, really helpful. So thank you for a great presentation. So Lynn, one of the questions that's come in is, how do you think we can strengthen the triangle of links between general practice, mental health services and City Care, both at the front line and more strategically? So really keen to hear your views on that.
I think we've got I think the ICP can really help to do that. I think it's a really good vehicle for supporting that. So when I think about the PCNs and the development of the PCNs, I think having all partners, that triangulation of partners together. And when we've got the data, when we look at our population health management data about how we prioritise what we need to deliver and focus on our most vulnerable, then it really is down to how do we, as different organisations, share, like events like this. Understanding what we all do is a really good starting point. Having those joint objectives, being clear on our purpose, and actually supporting each other and helping to bring our workforces together so they can understand and support what we're trying to do. So we've got a vehicle, we've got a plan, and it is about us really collectively getting on and delivering it.
That's lovely, thanks, Lynn.
I always got to come in there, so I think I agree with you, Lynn. And I think also, obviously, there's some work to do at that sort of level, at the ICP level, and building those relationships. But you're quite right. I think we need to sort of, over the next 12 months, real focus on the sort of PCNs. I think they're a real opportunity. Obviously, our primary care networks have their clinical directors and deputy clinical directors, but I think there's an opportunity at that PCN level to look at that sort of PCN level leadership and how we bring people together at that neighbourhood team to strengthen the relationships, sort of build those bonds, and I think that would be a great platform, won't it, for going forward, and sort of bringing mental health into that, both the healthcare trust, but also, of course, a community and voluntary sector. There's IAT provides us quite a lot of people in the mental health sort of services, and particularly given the effects of COVID on the mental health of our citizens, I think there's a real opportunity to do some interesting and important work in that sort of area.
Yeah, I think we've started all of that, Hugh. I do think that it's not the start of a journey. I think that with a priority around mental health, we've got a route map for it. So it is about how we strengthen it, because I do think all of the work that we've done so far and where we are, it puts us in a really good foundation for taking that forward.
Thanks, Lynn. So another question then is thinking about engagement. So how can we keep wider community members engaged, and how do you think we can make best use of the assets available to us as a system?
Oh, what a fantastic question. And this is, I think that we could develop this forever. And, I think this is where we need to think about, because around the ICP, we are quite inclusive, but clearly not everybody is going to be part. There's lots of organisations doing fantastic things in our city, and therefore having clear communication plan and making sure that we know what people are doing. I mean, today is about understanding people that we've worked with for years. We don't actually know all the detail of things that they do. So I think that there is a piece of work at ICP level to really scope out the great work that is happening. And I know many organisations do lots of things that we don't talk about. So how do we engage with them? I think we need to think about our current, community voluntary sector infrastructure. Again, we've got really good links. We've got partnership with Health Watch, and they're only part of it. But I think there is something about working with our infrastructure organisations who know and understand our local communities, but also to say that we need to have it as a strategic priority and focus on how do we do that, and listen, because I think people will tell you how we can best engage. So we've got to have our ear to the ground as well.
Thanks, Lynn. Rich, as Programme Director, do you have any sort of thoughts that you'd want to share?
Well, I think Lynn's made really good points there. I think it's all about us making sure that we engage with people and make sure services are right, and not assuming that we know what we're talking about all the time. People's needs change, the environment changes rapidly. Thinking at the moment about the rollout of the COVID vaccine programme, the City ICP's taken a bit of a role in coordinating some of that activity and understanding perhaps why there aren't levels of uptake within certain communities, and we can't guess at that. We have to understand from those communities why there's not the level of uptake, and perhaps what the best levers are, who the best people are to deliver certain messages. And so really, really crucial but it's, you know, I guess we have to be realistic in understanding we're not going to get absolutely everybody's voice, but we should be open so that people are able to input as and when they want to, and help us to shape our work.
Thank you. Okay, and then we've got another question, which is obviously now moving on into sort of the reform, so pending NHS reform. And we're just being asked, Lynn, about how do we think it'll affect City Care, and do we think there'll be an impact on City Care's position in the ICS?
I think it could potentially, but also having to think around, there are a few things that, one, there will be a partnership forum within the ICS that will need to be strengthened from where we currently are. So I think City Care has certainly got a role to play in, you know, that wider partnership forum, but the nature of the organisation that we are and the links. And I also think that one of the things that's come out very strongly is about actually social value and the expectation that that will be part of system working as well. So I do think we need to build on the strengths and the experience of different organisations in our system. And I think this is one of the things that, you know, City Care has been a core part of that system working for some time. And therefore, you know, will that change? The services that we actually deliver are actually key for the delivery of the objectives of the ICS. But I suspect there will be change. I think there'll be changes for more than City Care. I think that whole infrastructure will look very different this time next year or sooner. But I do think the role that we play and how we work, and you know, and I think bringing something different to the table and having a level of diversification at ICS, ICP and wider levels is really important. And I think it will come down to City Care and partners as to just what is the future position of the organisation.
Thanks, Lynn.
I was going to come on that. So I think it's a good question, and I don't think anybody can give you a firm answer yet, because everybody's working through, and it's a white paper that hasn't gone into statute yet. I think the other important thing for sort of people on the call is, whilst there's some very structural bits in that paper, the key thing is that actually it really focuses on place, which is what the ICP is all about. It doesn't tend to use the word ICP because actually at different places use different terminology, but it's very clear that actually place and that sense of place is where a lot of the work and a lot of the transformation can really happen. Yes, you need an ICS above, and there's some things have to happen at ICS level, but the real sort of work with our communities, that's going to be at place and PCN level, and that they're going to be the engine rooms over the next couple of years of where things really happen, which I think is put, you know, so it's great we've got City Care as a key member of the ICP, because I think actually with the, you know, we've got some fantastic PCNs in the city. I think the ICP is maturing, and I think it's a real opportunity for us. And the, you know, and I can't thank City Care enough for their both their support of the ICP. I think I would also just like to note, sort of, thank City Care for their work over the pandemic, because actually Lynn and the staff have been fantastic actually, and it's been a real bonus having City Care helping and being flexible, as you say, Lynn, during what has been a heck of a year for everybody.
Thank you. Okay, and our final question then, Lynn. Obviously, you've been Chief Executive Officer now of City Care for 10 years. What's your aspiration for the ICP over the next 12 months?
I think what I'd like to see over the next 12 months is the fact that we formalise some of the arrangements that we've currently got, that we're able to take on a lot more from decisions that are made about, you know, the wider system, and really do that locally. I think one of the earlier questions about how do we work differently with mental health, with primary care. So I think that aspiration of, you know, really nailing that in a way that is you know, seamless, that it is we feel that we've been doing it all of our lives, that it is working incredibly well, and that we continue to build the culture of the ICS in that way of, you know, people feeling that, you know, valued for all their contributions, irrespective of those organisational boundaries. I'm sorry, I feel I'm waffling on that question. But
no, it's lovely. Thank you. No, we're bang on time. So thank you, Lynn, for a fantastic presentation, and thank you, Hugh and Rich. Do join us again for the next Share and Learn. We've got a series running now till May, and do promote these, please, and share them with your colleagues. So thanks for joining everybody today.